So just wanted to take a few minutes to give you a brief introduction to dynamic stretching AFO, and this is specifically the design that we use in Allard Multimotion ankle joint, and just to show you how the joint works and sort of talk about what our strategy is as far as creating that stretch and making sure kids are comfortable and tolerate the bracing. This joint is adjustable with the tension, and it's kind of spring loaded. There's a little gauge right inside the joint here, and I'm going to give you, the parent, the tool to be able to adjust that. And that adjustment is right in the front of the joint right here, and you turn it one way, you'll see there's a number in this little window. You'll see the number go down when I turn it one way, and you'll see it go up when I turn it the other way. And the higher the number, the stronger the stretch. And so what we do is, while you're here at the office, I'll start you off and tell you what number to start with, and then typically we want you to adjust the tension by no more than one number every week or 2 weeks, depending on your child, and I'll go over that with you. But the goal is always to make sure they're comfortable first. So we start with a low setting, a low amount of tension on it, and then gradually with this adjuster tool every week or every other week, as I mentioned, we want you to turn that tension up. And then as you increase it, the stretch becomes greater, and we just slowly increase that tension to make sure that your child is tolerating the increase in the stretch, with the goal generally being for a child to reach a full 20 degrees of dorsiflexion. That's where we set this limit. So this is 20 degrees beyond a 90-degree angle. And if we can achieve that, that's wonderful. That's basically very close to a full range of motion. A lot of kids won't get that much range, but the goal is to start at a low tension, gradually increase it as long as they're tolerating it. And by that, we mean able to sleep with it, sleep through the night, and not having any sort of redness or pressure sores. As long as they're tolerating the increase, and only until we achieve that full 20 degrees. If we get to the point where your child is sleeping in that full dorsiflex 20 degree position, then there's no need to turn the tension up anymore. We're happy with that. The way that it's made to move and adjust is if they roll over and wake up in the middle of the night and feel the need to push and stretch, this will allow them to do that. It'll move with them, and then when they relax again, the tension pushes back and holds them into that stretched position. So the idea is you have the adjustability with the joint to make sure that you're always turning it up just to the point where it becomes too much, and then if it's too much for them, you can back it down, and you know exactly what that point is, and you know that we're doing everything we can to help stretch them at night without overdoing it or making it too uncomfortable. As far as putting this brace on, the reason that we typically are providing these is because kids have tightness in the heel cords back here, and so this being in 20 degrees of dorsiflexion, you'd have a real hard time getting the heel down in. There's this little lever down here. If we just pull the AFO back to any given position and swing this lever up right there, it'll lock it and hold it at that angle. And so that lock down here is made just to make it easy for you to put the brace on. So at this angle, you should have no trouble putting this on, and I'll show you that in a minute. This opens up, put the child's foot in, make sure it's strapped in, make sure the heel's all the way down, and then once it's on, then you release the lever, and it's always unlocked while they're wearing it, while they're sleeping. That way, if they feel the need to push against it, they can move against it and stretch and move, and then when they do relax, the brace is able to move back forward and push them into a dorsiflex position very gently. We do put soling on the bottom so that kids who do stand, or if they get up during the night to go to the bathroom, they can walk on it without slipping and falling. It's not generally made for a lot of high intensity kid type activities, but for going to the bathroom, or if you put it on in the living room and they want to wear it to walk to bed, or getting up in the night or first thing in the morning, that should be fine for them to walk on it. And again, you want to make sure this joint is always unlocked and moving freely while they're wearing it. All right, so this is our Allard Multimotion dynamic stretching joint, and here's the adjustment tool. Just want to show you how to adjust it and how to put it on. Now if you look right in the window right here, you can see there's numbers in there. Right now it's at number 4, right? And so we want to turn it down. So what we do is make sure that it's unlocked first of all, and we have a dorsiflexion limit set on it, so it only goes so far forward and then it stops. So we go to that limit, and then this tool goes right in the front right here. And you'll see when you turn this screw one way, you'll see the number go down, which there it's going down to 3. Okay, or if you turn it the other way, it goes up. So what I need to do, it goes up to 8, is I'm going to turn it down to 3 to get started, right, to get back into wearing it. And then the way that we put it on, there's also this little lever right here, which is a lock. So right now it's got the tension on it, but if I pull back on the foot just a little bit and then flip this lever up, that locks it at whatever angle I set it at. So I'm good, because of his strong tone, we have it set at an angle like this just to make it easier to put on. And then once it's on, then we loosen the lock in order to have it work while he's sleeping. So it's locked right now. I'm just going to open this up. Can I see your foot, buddy? And again, you want to have him seated where he's relaxed and comfortable. Where he's relaxed and comfortable with bringing the knee right up towards the chest. And sometimes I push right underneath the toes here. That can help release, to relax the tone as well. So yeah, he feels like he's all the way down in there right now. Let me just take this strap, pull that through, and I've got the mark on there. Like that. So once that's on, where he's all the way in, we do recommend pulling the sock here just to make sure there's no wrinkles underneath here. So pull up this way and pull out towards the toes. Okay, because we've got all this pressure right here trying to hold the heel down. But then once that's set, then you just go ahead and flip that lock down and make sure it moves free while he's wearing it, while he's sleeping. This strap up here does not need to be real tight. That one you can just lay down across there. And that's it.
Good.
Okay? So the lock on the joint is just to make it easy to put on. Once it's on, we want to unlock so it moves free. That way when he does relax during the night, it's just going to gently push back. Sound good?